करना चाहिए कि पेशेंट को बेनिफिट हो रहा है कि नहीं, पेशेंट को नंबर ऑफ डोजेस रिड्यूस हुए कि नहीं. न्यू प्रिस्क्रिप्शन शुड बी गिवन विदिन 6 months. Now, as we already started with the thing, only nicotine replacement is not going to work because you require motivational support. You require counseling. Just like, for example, alcohol, we have alcohol anonymous groups where they motivate each other, sharing their experiences. So motivational support will be required for those who are dead addict to the nicotine. Those who can get the withdrawal symptoms, उनके लिए motivational support देना बहुत जरूरी है. It is not a replacement for it. Motivational support is what is required. Assess the patient's level of motivation also. General guide हम लोग और क्या करना चाहिए. Ask the patient about the tobacco use. हर visit में करो. Advise about stopping of the smoking. Assess willingness to quit. Are you really willing to quit? Assist in counseling, social support, drug therapy, and arrange for the follow-up. Every 2 weeks we can plan for the follow-up, because many a time we call the patient for follow-up not for patient is better with the treatment or not, whether the patient getting complications because of your treatment or not, because nicotine also has got a lot of complications, as we already talked about. So we ask the patient to follow up to know your treatment complications, also to know whether the patient is getting benefited or not. So every follow-up visit we can go for counseling. Very, very important. The effectiveness of nicotine therapy is similar to that of the bupropion, वो हम लोग आगे वाला लेने वाले. But because it is safer, it is what also. Bupropion is also a chemical we can use. इसके बाद में हम लोग वही drug लेने वाले. But nicotine is the most common one, so I thought I can take it first. Nicotine replacement therapy will not abolish the cravings, nor it will address the social impact of smoking behavior, but it can reduce the number of times patient requires. Of course, craving to come karta hi, that is what is required. But the notes also says that, but let's see. But is available as a chewing gum, as I already talked about. It's also available as a transdermal patch, as an inhaler also, nasal spray also, lozenges also, and sublingual tablets also. Now, we are going to prefer these for different kinds of patients. क्योंकि अगर पेशेंट को, you must have heard about this, something called a chain smoker. दिन में 50 cigarette पीते हैं, for example. For those, the patch is going to work because they are used to have nicotine in their blood around the clock. लेकिन जिनको intermittent attacks आते हैं, let's say for example twice in a day, for example, or thrice in a day, उनको हम लोग chewing gum दे सकते हैं, उनको हम inhaler दे सकते हैं. So whenever they get craving, they can take the inhaler, they can take the nasal spray, they can take the lozenges, or they can also take the sublingual tablets. They're available in all formats. The use of gum is also best established. That is what is. You must have heard about Nicotex as a chewing gum. The patient who smokes less than 20 cigarettes a day, 2 milligram of gum. More than 20, 4 milligram of gum. Chewing gum as required. Usual usage is about 8 to 12 gums in a day. Or whenever they get cravings, they can take. As the day progresses, as the craving reduces, you can reduce the amount of gum chewed as the cravings are going to reduce. So chewing gum is what is readily available, marketable also. You can also keep it very easily. So more less than 20, 2 milligram, more than 20, 4 milligram of gums, or gradually whenever they get cravings, they can chew the gum. Treatment is usually for maximum for 3 months. By the time the nicotine withdrawal का जो भी आने वाला है वो आ जाता है, and then they can gradually reduce the nicotine replacement also. Is not subject to any major drug interactions. Right? Serious adverse effects हम लोग already देख रहे थे. कुछ पेशेंट में urticaria, skin rash हो सकता है. They can rarely precipitate atrial fibrillation. थोड़ा heart rate बढ़ता है. Normally, first time those who are taking the chewing gum can complain about tachycardias. Nicotine patches can also produce local erythema and hypersensitivity reaction, but it is comparatively safe. कोई serious drug interactions इसके नहीं है. So that is the reason we can prescribe the chewing gums or lozenges or also sublingual tablet, and nasal sprays and nasal inhalers are also available. Select the patient as per the motivational support. जो सेल्फ मोटिवेटेड नहीं है उसमें हम लोग नहीं दे सकते. इट इज ऑल्सो अवेलेबल ओवर द काउंटर